everybody, it's Dr. Joe. I've had a lot of people ask me some anatomy questions, so I'm going into teaching mode today and I'm going to talk about the anatomy of the knee. Let's get started. Disclaimer alert, disclaimer alert. The folks at GPI Anatomicals were so nice to send me some of their models. They sent me some mini versions, which is really cool because if you travel a lot, you can take them with you and you don't have to use a lot of room to take them. So this is the knee model here. Down here is the tibia bone and up here is the femur bone. So when they come together to make the knee joint, anytime there's something going on in there, it can cause a lot of pain either to go up or to come back down. Here is your quad muscle that goes into your quad tendon, and it comes over the patella or your kneecap. And the reason that's really important is a lot of times with the knee, people end up having tracking issues of their kneecap. And so it doesn't go straight up and down like it's supposed to. It pulls to one side or the other, and you sometimes get that popping sensation, feels like bone rubbing on bone. And the two common causes of that is either a really tight IT band and or a really weak VMO. So if you strengthen the VMO and stretch the IT band, that will help get that tracking going a little bit better. And you can check that out in my patella femoral pain video, and you can check that out in the description. Also, if you flip it over, you can see a little bit on the inside. Here are the menisci, the two meniscus that you have, and you have your medial and lateral meniscus. And a lot of times, how I describe a meniscus is it's kind of the suction cup in the joint there, and if it's torn a little bit, then you don't have that stability anymore, just like on a window and you put the suction on, but if it has a little tear in it, it doesn't stay in place. And so that is why those are so important. And if you get a tear, then you don't have that stability, and a lot of times when people say they're walking, they feel like that knee is going to give out on them. And you can also check out my meniscal tear video as well, which is really good, shows you some stretches and exercises for it. On the inside here, you have your ligaments, like your ACL and your PCL. Those are the ones that shift back and forth, and they protect your knee from shifting too far one way or the other way. And when they get torn, that can be a very big stability issue as well. So those can be very scary. And most of the time you hear the ACL is torn, a lot of soccer athletes and things like that, but the PCL can get torn as well. Over here you can see the fibula and all the attachments there, and then coming back up you can see the femur here, how it kind of can roll onto the tibia. So that's kind of neat just to see everything on the inside, and they've got those muscles kind of cut away so you can see what's going on. But down here you've got your calf muscles or your gastroc muscles, and they come up over the knee. So when those are tight, they end up pulling on that joint. So those are a big one to stretch in general to take away some pressure off of that knee joint. And then your hamstrings are up on top here, and they also cross, they go the other way. So when those are tight, they also need to be stretched as well. Also, this quad muscle and tendon on the front, the one that I was talking about that holds on to that patella, the kneecap, if it's tight, what happens is the patella usually just kind of floats in there and tracks really nicely and smoothly. But if this is tight, it pushes on that kneecap, and then it ends up grinding every time you're bending and walking. So if you stretch that out, you can really get that loosened up and not have as much pain either. And I also have videos for all of those stretches. And I also have just some knee general stretches to help you get everything loosened up if you're just having knee pain and you're not exactly sure what it is. And I also have a real-time video for knee pain stretches that'll stretch out all those muscles for you that you can follow along with me while I'm doing them. So that is kind of it in a nutshell. There's a whole lot more going on in that knee, but those are probably the biggest things that you're going to see in there. And once you kind of see where it is, then sometimes you go, oh, okay, yeah, I can understand why it's hurting like that. And then it helps you figure out how to get it stronger and get it more flexible and get it moving again. So there you have it. If you have any questions, leave them in the comment section. If you'd like to check out some of those other videos, go to AskDoctorJo.com. And remember, be safe, have fun, and I hope you feel better soon.